everybody, and welcome to The Better Life with Dr. Pinkston. I am Dr. Mariane Pinkston, and bringing you another great show on something that I have a lot of passion about, and so does my guest, and the company that we are talking about this morning, who is now a sponsor of The Better Life, and I am so glad to have them back on board. So I want everybody to welcome Dr. Rashmee Patil this morning, who is the new CEO of Pinnacle Clinical Research. And if you remember, which I've said many times, that Pinnacle Clinical Research is a research for liver disease, and we're going to describe all that and encompass all of what liver disease actually means. But they have a free fibroscan that patients can take advantage of, which again we will highlight. But I want to welcome Dr. Patil. Good morning. How are you? And congratulations on your new position.
Thank you so much. Thank you for having me. It is really, it's an honor to be here, and I'm really excited about the new role, coming on as CEO of Pinnacle Clinical Research.
Yes.
Really, we are a best-in-class clinical research site network with our main office, our hub in San Antonio, serving the San Antonio community.
Yes, absolutely. And so tell me a little bit about yourself, first of all, and then also about how Pinnacle came to be here in the union of your two companies.
Yeah, for sure. I think it's important to sort of take a step back, who I am. I'm a Texan at heart. I was born and raised in Southeast Texas.
Yes.
And I am a physician. I am a fellowship-trained hepatologist, and I moved to South Texas, not San Antonio, to the Rio Grande Valley,
yes,
which is what real South Texas is.
Very South Texas, yes.
To start a hepatology practice and to help the community potentially start a liver transplant program there.
Wonderful. Because
there is a lack of liver specialists in the region.
Sure.
And at that time, I met Dr. Harrison, and while I was building a practice, I also got interested and invited into the clinical research world.
Yes.
And as you know, non-alcoholic fatty liver disease is a huge problem. It's a global problem.
Yes.
And in the valley, what we call South Texas, it is an even bigger problem.
Enormous,
so,
yes.
We estimate that the prevalence or how common the disease is probably more than what the national averages are.
Sure.
And so I built a clinical research program actually at the hospital where I was working, and eventually decided, hey, I want to do this on my own. And I ventured out, put on my entrepreneur cap, and started a company called South Texas Research Institute.
Mm-hmm.
And that was just the beginning of this journey. We started with 5 employees in our main office in Edinburgh, Texas, where I'm sitting today.
Yes.
And we expanded through COVID in 2020 from 5 employees to 30 employees. We expanded to a second office in Brownsville, Texas, about an hour away.
Right.
We were able to do was really bring awareness about what non-alcoholic fatty liver disease is, mm-hmm, and to build a research program for patients who have real problems with fatty liver to gain access to potential treatments through clinical trials.
Right.
And eventually what happened was we became successful, and we met Pinnacle, and we thought that there was some synergy there. Mm-hmm. And so the companies have now joined to serve this greater purpose. And I'm coming on as CEO of Pinnacle with an amazing leadership team. Yeah. And our goal is to really continue to move the needle forward in getting drugs approved for the treatment of fatty liver, and also increasing just awareness about the disease in general.
Absolutely. And I applaud that so much, because you're right. And the reason you're in South Texas doing this is because it is an enormous problem in South Texas. It is in San Antonio, but as you go further south, I know this is a huge problem. A lot of good reasons for that. And, it's wonderful that you are, joining forces with Dr. Harrison and the entire group. Amazing physicians. And you're right, this is a global problem. And, the company represents internationally as well. I know Dr. Harrison has given some lectures, and not sure your lecture background, but I'm sure you have too. And so I love that you guys have joined forces and are going further, more widespread, covering more areas. And I think that the fatty liver disease is something that is undiagnosed largely, and so I think as you said, the numbers are way underrepresented. I think that it is a much larger problem than we know, and we are really going to try, I think, today to put in the minds of people that even if you think you are healthy and you don't have liver disease, you might, and you need to be checked. There's a lot of supplements, a lot of, alcohol and Tylenol. I mean, there's so many reasons why people don't really know that they might have liver disease underneath. And so that fibroscan, and that is where I want to keep highlighting that you can get a free fibroscan from Pinnacle. Just go to pinnacleresearch.com. That's going to be on my website, but I want to make sure that you guys can go to the website and find that and get scheduled and get a free fibroscan. And so do you have kind of a personal story behind liver disease, or what brought your heart into treating liver disease?
Yeah, that's a really good question. Because I think it takes a specific type of person to like hepatology. Yeah. And Dr. Harrison and Dr. Rudhraju, who's our chief medical officer at Pinnacle Clinical Research.
Yes.
She's a board certified transplant hepatologist, amazing hepatologist. We all, I think, are drawn to hepatology because it really is more of a cognitive field. Like I did internal medicine in residency, and I remember seeing patients who were just so sick. When you talk about end-stage liver disease,
it's awful.
Cirrhosis, all of the problems that come, liver cancer types of patients who really had no hope. The hope that they had was maybe that they would be able to get a transplant.
Sure.
And so I was drawn to not only, helping those patients through the pre and post transplant process, but also in some sort of prevention for how did we get here, right? How did we get to this type of clinical picture?
Absolutely.
And so I thought that it was a good mix for me. Between, very end stage disease, but also coming in on the preventative side.
Right.
And, the hepatology, the liver disease community in general is very supportive. We're a smaller community, I think, but I know almost all of the hepatologists in Texas because it is such a small community.
It is, yeah.
And so, I love the field.
Yeah, it's wonderful. And so I think many people know, I've said it several times, I have an autoimmune condition of my liver, and, I eat great, lost a ton of weight. I don't know if you know my story. I lost 163 pounds at one point, and trying to get rid of an autoimmunity and inflammation, and it didn't go. I feel a lot better, but still wound up with autoimmune hepatitis, and it's very scary. And so I've been through your process of the fibroscan and talking with your docs, and it's a great process. So this is definitely near and dear to my heart as well. I'll share that with you to try to get folks to get in and get just a free. It takes 3 minutes, I think, is 3 to 7 minutes or something like that. I was there for 15 minutes maybe, but I got the fibroscan, got to talk to the doc, and, it was a wonderful experience. So you can do it quick and easy, free. There's no other wonderful word I can put behind that will make people get in and just take a look. Just take a look. And then they can spend time with you guys to figure out how to, prevent further deterioration, because liver disease is a horrible, horrible death. It doesn't happen quickly like a heart attack or, something. It is a slow process, and it is very, very ugly. So we really want people to get checked at pinnacleresearch.com and get scheduled very easily. So yeah, you're right. Hepatology is kind of an interesting field, but it's a growing worldwide problem. So I'm glad you guys are doing it. What do you see ahead now for you guys as you grow, and what kind of things do you guys want to accomplish?
Yeah, I think that's a really good question because, we're thinking about what we're doing well right now. And so I wanted to just touch a little bit more on the fibroscan because I think the way that we kind of talk to our patients about it is, look, it's a, what I call it is it's like the EKG, like, you get a check of your heart. It is the EKG, or the vital sign of the liver. So anytime I go to see a patient, I look at the fibroscan. The patient has had a fibroscan already. And this tool allows us in, like you said, 10 minutes to look at not only fat content in the liver, but also the stiffness of the liver. So look, I mean, a normal liver is healthy like a sponge, right? It's a very soft looking liver. But as liver disease progresses, no matter what is the cause, whether it's autoimmune hepatitis, like you were saying, affected you and affects you, whether it's viral hepatitis, alcohol, non-alcoholic fatty liver disease, that chronic inflammation leads to scarring in the liver. And scarring in the liver is what causes the liver to become stiff. So we don't like a liver to look stiff on the fibroscan. And so when you come in and you get the fibroscan done, in 10 minutes, we can say, look, Houston, is there a problem? Yes or no? And if there is a potential problem, then we can talk to you about the path forward. But really important, because even for primary care physicians, right? You look at patients who are at risk of developing fatty liver, and what we say is really look at the risk factors. People who have diabetes, people who have cholesterol problems, high blood pressure.
That's South Texas entirely, really.
So the more of those components that you put together, the higher risk you have of developing a more progressive form of non-alcoholic fatty liver disease. And that's actually a separate disease process called NASH, or non-alcoholic steatohepatitis. Basically, it's a fancy term for saying you have not only fat in the liver, but also inflammation. And so when primary care physicians are identifying these patients who may have NASH, the fibroscan is a great tool to put your patients in a risk bucket, right? Are they low risk? Don't need to worry. We talk about lifestyle modification. Are they intermediate or high risk? I'm going to send them to a specialist so that we can sort of track disease. And so the fibroscan, I just want to harp on it because it is such an amazing tool. And it's what we use in clinical trials every day. We don't even talk to patients about the potential to enter a clinical trial unless they have a high risk finding on their fibroscan. So, if you are interested in assessing your liver health in general and you have one of those risk factors, please contact our offices. We have offices in San Antonio. We have offices in Austin and in Georgetown as well. And of course, I'm in the Rio Grande Valley. We talk about fibroscan all the time. Just wanted to reiterate that.
And I want to harp on the fact, too, that primary care needs to be very proactive about scanning. And, mainly because liver disease, the liver, I always tell my patients, the liver can be a very forgiving organ. I mean, there is a lot of opportunity to stop and even reverse this disease process and spare yourself that end stage, horrible decline. And, to catch that early and really get aggressive and intervene. And we're not talking about needles and poking people and biopsies and crazy things like that. That is for people who are, progressed, largely deeply into the disease. We can catch this early and do a ton to try to help patients stop and reverse that process and save lives. And that fibroscan is painless. I sat with my arm up for a few minutes, and she just had what looked like a little ultrasound wand and just kind of touched my abdomen a couple of times, and it was over. And then like I say, I got to visit one of the docs, and then off I went. And so got a lot of information in 10 minutes, and I think then absolutely the pathway from there is very, very clear that we know how to handle this. We know what to do. You know how to handle this. You know what to do. And it's a great, great process. So I love it. And so pinnacleresearch.com, go there, get scheduled. It's the first thing you see. Schedule now and get scheduled very, very easy. Free. Like you want to, people
Yes,
are always fearful. Does my
that is
insurance
awesome.
cover it? No, your insurance doesn't need to cover it. It's free, and that is wonderful. So how can people, is there a way that you prefer for people to get in touch with you? I know I've got a few phone numbers. Happy to go over those. Let me give those actually. And so
Yeah.
in San Antonio, you are at 210-529-7978. If you have any questions, please call. In Austin, I'll give it to you because people can hear us in Austin. 512-601-5788 and pinnacleresearch.com. Is there any any other ways to look up more information or read a little bit about things if people are unsure?
Yeah, I think we have a website presence where you can schedule your fibroscan at pinnacleresearch.com.
Yeah.
And also we're on all social media. So
Sure.
I know that we work on Facebook, we work on Instagram, we're on
Yes.
LinkedIn, Twitter, however you would like to sort of learn more about our physicians and learn more about our, just in general, our expertise, because we combined have probably the best expertise you're going to get in the city of San Antonio as
Right.
it comes to liver disease.
Absolutely.
And, just check us out, and we're happy to meet any patient where they are in their journey.
Absolutely. So a lot of information can be found on, and I'll have all of this information on my website as well. You guys are going to have an eternal presence there. And so just go to drpbetterlife.com and you can find the previous podcasts with Dr. Harrison and all on drpbetterlife.com, on iTunes, Spotify, iHeart, radio, all of that. And also can be found on the Healthy Choices Network on SiriusXM. So we've got a large presence at YouTube, so can't forget that. But definitely here on San Antonio Radio on Sundays at 4 p.m. So I will have, again, all of that information on the website, drpbetterlife.com, and go to pinnacleresearch.com, schedule in, go get your fibroscan. Just make it a part of, your morning when you go get your coffee, go get your fibroscan, go to work, and you've got a break coming up at lunch, go get it done, but schedule in. And this is very, very important. I think too many folks are underdiagnosed. So we are going to take a short break and be right back, talk a little bit more about fatty liver and Pinnacle, and we'll be right back.
Fatty liver is linked to two different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called fibroscan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your fibroscan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back. I'm Dr. Mariane Pinkston, and this is The Better Life with Dr. Pinkston. And we are talking with Dr. Rashmee Patil this morning, the new CEO of Pinnacle Clinical Research. And so happy to have you in. I think, we've talked a lot about fatty liver. We talked, a lot about diagnosing and screening. But what about those folks who are afraid of what, I think if I go get scanned, that means if I find out bad news, and I'm always scared to find out bad news, everybody else is, but I'm also scared of what the treatment might look like. And then also, we're talking about a research institute, so people may feel like they're a guinea pig and kind of hesitant. And so let's overcome those obstacles. What about, just getting diagnosed and scanning and treatment?
Yeah, I think that's a really great question again, because look, I've been doing this for several years. I've been an investigator in clinical trials for a while now. And so I talk to patients daily about what it means to potentially participate in a clinical trial. And look, we don't even start that conversation with the patient unless they have high risk findings on their fibroscan. But if they do, what's the next step? Like, what do I do about this? How can I potentially reverse the disease? And so the first thing we always talk about is lifestyle change. We talk about if you can lose 7 to 10% of your total body weight,
it's not much.
You can actually, not much, you can actually impact fatty liver disease quite significantly.
Absolutely.
And so we talk to patients first about that. But look, the reality is that it's tough to lose weight. And there are data that show that, most patients, even if they're able to lose that 10% total body weight, most patients aren't able to keep it off, after that year time. And so what we say is, look, if you have high risk findings, we really need to know more. And in a clinical trial, we're there for you to help you to learn exactly how much liver disease you have. So we talk to you about the trial process. And if you qualify through some further investigation, which typically involves blood work, an MRI, an advanced MRI of your liver, which you only get in clinical trials, and potentially a biopsy. There's always the potential of a biopsy, but we talk you through all of that.
Right.
And if you have enough disease and you get the understanding of where you are and you have more scarring in your liver than we'd like, we really have to throw the kitchen sink at it.
Yes.
And part of that is getting access to a drug that may help. Unfortunately, if you go to your primary care physician or even to a gastroenterologist, a specialist, there are no treatments currently that are approved by the FDA. Absolutely. So just like you take medications for your high blood pressure or your diabetes, all of these drugs went through a clinical trial process.
Absolutely.
And in order to get approved by the FDA, there's several, regulations that are followed for that drug to be approved.
Right.
And I think patients feel scared about being in a clinical trial and potentially taking an investigational drug. But what I can tell you is that we are so highly regulated in this field.
Absolutely.
It is the most highly regulated thing and the safest thing a patient can ever be involved in, because we as physicians are watched by so many different agencies. And if we ever think that maybe the investigational drug is, causing a problem or maybe unsafe for the patient, we can pull them off of the drug, A, and B, it's completely voluntary. So if a patient feels, for example, that it's not the right fit for them, they also can come off of a clinical trial.
Right.
And so, listen, it's a partnership throughout the study, but it's also advanced care free of charge to the patient. So I don't see many cons. And in fact, when I talk to my family members about, really getting an understanding of what type of disease they may have, no matter whether it's fatty liver or any other disease state, clinical trials are a real advantage. They are the cutting edge of medicine.
Absolutely. And, just something that as we kind of get close to the close here, I feel like people think that the clinical trials that, you just invented this drug and now you're the first kind of rat to go through, the study. And what people don't realize, by the time we get to human trials, it's already been through some rigorous studies and investigations. So by the time you get to the human trial, they're about ready to launch. I mean, it's almost ready for the public. This is kind of the last stage, and correct me if I'm wrong, but the other thing you need to think about too is that, you get access to drugs that aren't really out there, for the general population. And if this is something that, you're working with working with a team who's watching very closely, and, you're getting a lot of better treatment almost in a lot of aspects, and you're being watched more closely than you would just out there on a medication following up every 3 months or so, but you're also helping other people. When you go through this and this gets approved, then that you can say, I was a part of that, and now it's available, nationwide, worldwide, and I was a part of that, and you are helping the people behind you. So it's very important for people to volunteer themselves to do this type of work, and it is safe. It is, by the time they get to that point investigationally, it is safe, and so I want people to not be hesitant about that. We do need to highlight again about starting that process, though, and just getting some knowledge. Even if you decide not to do anything about it, you need to know what is going on in your body. And you may not have any symptoms. This may be a surprise to you. And so even if you think you don't need screening, you need screening. So we're going to try to get people to go to pinnacleresearch.com and sign in and schedule for a fibroscan and go get that done. As we kind of close things down, I told you it goes fast. It's crazy, right? I wish we had all day to do this. Any closing thoughts for the things that you would like folks to know?
Yeah, absolutely. I think my closing thought is this. At the end of the day, you as a patient, you have complete control over this situation, right?
Yeah.
So people say, look, I want to know about my liver health status.
Yeah.
We're giving you an opportunity to do that. And even if you, for example, don't have access to that with your primary care physician or with your specialist, call us. Absolutely. Because it doesn't require a referral. You can come into our offices and know your liver status. Right. And I think knowledge is always power.
Absolutely. I agree with you 1,000%. So pinnacleresearch.com and get scheduled. And again, I'll have all of this information for you on my website at drpbetterlife.com, as well as the previous in-depth talks about fatty liver that we've done in the past. And so, Dr. Patil, thank you so much. It's an honor to meet you, an honor to have you on the show. And I'm watching you as a woman CEO and proud of you, and congratulations, and thank you again for being on the show.
Thank you so much for having me, Dr. Pinkston. I really appreciate it.
Absolutely. All right, everybody, you have a good week. We'll see you next time.